Our top story here at 5 o'clock. The death by suicide of a Kern County Sheriff's deputy has put a spotlight on a much-needed conversation, mental health in law enforcement. 17's Michaela Armstrong spoke to multiple agencies in Kern to find out how much of a priority it is and has the details. Michaela?
Tammy, this conversation is a priority to all, but each agency has its own approach.
The job is already difficult, but being not mentally fit to do it could make it impossible.
In regards to the work that they do, it's very taxing. They see a lot of traumatic things.
Clinical social worker Naisha Davis says law enforcement faces challenges every day, which can trigger trauma and play a role in how they respond to the community.
If they don't address their mental health, or if their mental health goes unaddressed, I think it will lead to burnout, but not just burnout, job dissatisfaction, as well as I think it'll affect the way that they respond to the crisis and the mental health situations that they are dealing with every day.
Bakersfield Police Department Sergeant Varen Coleman says there can be a mental health stigma in the culture of policing, but within the past 2 to 3 years, the department has made it more of a priority.
The homicides, the bad car accidents, when they're involved in officer-involved shootings, when they're involved in car accidents, different things of that nature, we're no different than anybody else. It affects us physically, mentally, emotionally, and we need help as much as everybody else, if not more sometimes.
One thing that helped that change is the department opening a wellness center last year to help officers have a healing space.
They'll come in all the time and say, sir, this wellness center is amazing. It's awesome that we're able to come here. I feel safe when I come here, and I'm able to have a safe place where I can work on reports.
But last week, Kern law enforcement saw how important this conversation is when Kern County Sheriff's Senior Deputy Benjamin Harmonson died from a self-inflicted gunshot wound. KCS has not spoken about the matter publicly, but Commander Augustine Moreno said since the incident, mental health has been reinforced internally.
We've sent out multiple reminders to staff that there are different resources available to them for mental health as well as suicide prevention.
BPD has been supportive of KCSO during this time, and Coleman says this is being felt by all.
If an officer passes, we all feel it. That's where the thin blue line comes in at. When the call first came out, we were there for him, and we're going to continue to be there for him every day.
Davis says she had more clients after the COVID-19 pandemic who never experienced a mental health issue, and stresses the importance of this conversation.
This is a conversation that has to continue because the need for mental health services are definitely arising within our community in different areas.
If you need any help or know someone who does, call or text the National Suicide and Crisis Lifeline at 988. Michaela Armstrong, 17 News.